Well, greetings again, and this is Dr. Bill Wyatt with the American Orthodontics Society, and I will talk about just a plain, everyday problem that comes up in orthodontics, and this is a reverse tip. This young lady had a kind of a tongue thrust and was pushing the teeth out in this fashion, and we bring them back in. In other words, you put some reverse torque, or if you want to call it tip, and brought them back in, and maybe the tip is angling them back in the back. So let's see what the case brings up. There's not any real remarkable thing about it, but let's get going here and let's see if show you. The young lady has a kind of a straight facial profile. The chin could be brought out further to make the face look better, and we tried to do that where we didn't. You don't make the jaw grow, but you can move it up to class 1 relation, and it'll look better when it comes out. And that's not a good picture there, but here we look at the cephalometric picture where she's got a fairly good airway, and the tongue is coming in here pushing this out, and we put some little fingers on that tongue, and you can see where we in the diagnosis showed these deals coming out, and we're training the tongue while we're doing the case to keep it from coming forward in there. So this is she's age 8 and 2 months, and this is 87 when we did this. And you can see the little fingers that we did on the tongue thrust. Stop the tongue from going out there, and the teeth tend to come in, but they actually bring themselves in. Sometimes if the lip is tight and they're breathing through the nose and everything, the lip structure will tend to bring the teeth back into line again. So let's get on down the line here. Here we're extracting you've got a deciduous tooth into this first bite coming in. We're going to eliminate those, and we'll have to, when we take this will come back. We're going to bring that tooth back over in line, or as this tooth erupts down, it'll push it back into place over there. And we didn't have room for the wisdom teeth to come in. Here's the second molars had a job getting in, and this is, she's nearly 10 years old here, and a young lady doesn't grow much past 13, so there's no room in here, and the wisdom teeth don't have room to come in. There's no way of getting in. She's 9 and 6 at that point, and here she's 10 years old, and we're coming in, and I want to take the bands off of the second molars, the first molars, as it erupts, and those will come up in there. But we've got this wisdom tooth crowded problem there. Now, so she has all 4 wisdom teeth. She's aged nearly 11 years old at this point. So we have stopped the tongue thrust, and we don't have any room for the wisdom teeth. So we got those out, and we did a little intruding arch here, bringing the lower teeth down. So we brought these lower teeth down and out, and brought this back in by putting these fingers on here and stopped the tongue thrust. And now it's 87 and 91, and we finished her up, and there's the way she started, and there's the way we ended it, started, ended. There's the way it started, and that's the way we ended up. We did not take any teeth out on her, and we made room for the lower teeth to come in, and she's still kind of got a flat face here. We didn't want to reduce that any more than you have. But nice looking young lady, and the teeth are fitting in there good. Here she is later on in life, a little bit of curved in, but there's no teeth removed on there. There's no way her wisdom teeth could push that out. Her face will be that way. And looking at it from the front, and a good profile there, and everything looks good. So I'm going to close out here, and there she is in 93, and the teeth are lined up good. 93. And we didn't have room for the wisdom teeth. This is her retainer. We put a little bite plate in the retainer you see right there. And that ends up the case. Thank you for watching, and I hope you'll subscribe to our channel. And we're going to get over here and stop this. Thank you for going. I think you'll get something out of this case.